This is case study 5. During a triathlon, paramedics responded to a scene with multiple patients involving a serious bicycle accident. BR, a 20-year-old woman, lost control of her bike while descending a hill at approximately 40 miles per hour. As she fell, 2 other cyclists collided with her, sending all 3 crashing to the ground. At the scene, BR complained of pain in her head, back, chest, and leg. She also had numbness and tingling in her legs and feet. Other injuries included a cut on her face and on her right arm, and an obvious deformity to both her shoulders and knees. She had slight difficult breathing. A paramedic did a rapid cephalocautal assessment and immobilized BR's neck and a cervical collar. She was secured on a backboard and given oxygen. After her bleeding was controlled and her injured extremities were immobilized, she was transferred to the nearest emergency department. During the transport, the paramedic in charge radioed ahead to provide a pre-hospital report to the charge nurse. His response included the following information: occipital and frontal head pain, laceration to the right temple, superior and anterior to the right ear, lumbar pain, bilateral thoracic pain on inspiration at midclavicular line on the right and midaxillary line on the left, dull aching pain of the posterior proximal right thigh, bilateral paresthesia of distal lower leg circumferentially, varus adduction deformity of the left knee, and posterior displacement deformity on the left shoulder. At the hospital, the emergency department physician ordered radiographs for BR. Before the procedure, the radiology technologist positioned a lead gonadal shield centered on the mid-sagittal line above BR's symphysis pubis to protect her ovaries from unnecessary radiation by the primary beam. The technologist knew that the gonadal shield is important for female patients undergoing imaging of the lumbar spine, sacroiliac joints, acetubula, pelvis, and kidneys. Shields should not be used for any examination in which an acute abdominal condition is suspected. Then the questions. The term for the time span between the injury of admission and admission to the emergency department is pre-hospital. Cephalocautal assessment goes from head to toe. The victim's injured extremities were immobilized before transport. Immobilization means held in body alignment to keep from moving. A cervical collar was placed on the victim to stabilize and immobilize the neck. The singular form of acetubula is acetabulum. And then the questions for the diagram are: draw a dot over the area of the victim's occipital and frontal pain. Draw a dash over the area of the right temporal laceration superior and anterior to the right ear. Shade the area of the lumbar pain. Shade the anterior area of the thoracic pain at the mid-axillary line on the left. Draw a star at the area of the pain on the right proximal posterior thigh. Shade the bilateral paresthesia of the distal leg circumferentially. Draw an arrow to show the direction of the varus adduction of the left knee. Draw an arrow to show the direction of the posterior displacement of the left shoulder. Draw a fig leaf to show the gonadal shield on the mid-sagittal line above the symphysis pubis. Draw a circle around the sacroiliac joints.